Welcome to Your Diabestie, the podcast that ensures you never have to do diabetes alone. My name is Mila Clark. I live with latent autoimmune diabetes in adults, and I am the host of Your Diabestie. I am kind of excited about this episode. It is a new year. It is a new time for all of us, which is really great. And I think that also means that we're focusing on our health goals a whole lot more than we ever have. So before we get this episode kicked off and started, I want to let you know that I do offer free health coaching to anyone with diabetes who needs it. It is individualized. You can participate in our one-to-one health coaching offerings, or you can participate in our group coaching offerings. It is up to you, however you want it to go and whatever you want to do. But the Glucose Guide community is here for you. And I am also here for you with free health coaching. It is offered because of generous partners like Sigrid Therapeutics. And Sigrid has a glucose stabilizer that I just love and that works really well to help reduce my blood sugars, but also keep them really nice and stable. Tons of clinical research behind this product. But if you want to learn more about it, visit sigridstabilizer.com/Hangry Woman. And also visit hangrywoman.com/diabetes-coaching if you want to sign up for your health coaching slot. It is first come, first serve, and it fills up. Okay, like the January waitlist is almost full. So get in there. All right. So kicking off this episode, we're going to be talking about key questions that you can ask your doctors in an appointment. And we all know that living with diabetes can be challenging. But by actively engaging in conversations with your doctor, I think you always gain a better understanding of your particular place in your condition. And it also helps you to just help take more power and take your health into your hands. And a lot of times, just knowing and understanding some really basic concepts and having your doctor explain them to you are always happening because you're asking questions and because you're getting curious and you're not just having this passive conversation with your doctor of, yeah, I need this refill and yeah, I need this thing, but you're actively talking about the data, you're actively asking questions, and you're staying engaged in that appointment because you only have, I think, like a 20-minute appointment every time that you meet with your doctors. It is very short. It doesn't give you a lot of time. And so you really have to utilize that time in the best way that you can. One of the best ways that I think that you can utilize that time is by asking questions. I want to start off by saying that there are no dumb questions. If you don't know something, you don't know something, and you shouldn't be judged for that. And your doctor isn't going to judge you for that. They know that you're asking questions because you might not know the answer and you need a little bit of help. So take that out of your brain because it's so difficult to walk in thinking I'm going to ask this question and I'm going to look stupid. Like, no, you're never going to look stupid. And really asking these questions is all about making your health better. So what kinds of questions can you ask when you walk into a doctor's appointment? And I have a few examples of questions you can ask and then, why those questions are important. So first, what type of diabetes do I have and what does it mean for me? And understanding the type of diabetes you have is crucial for your doctor to develop an effective management plan. So whether you're living with type 1, type 2, gestational diabetes, or pre-diabetes, knowing the specifics allows you to tailor your choices accordingly. Understanding the type of diabetes is the base level, and you can even ask clarifying questions like, what is my body doing? Or why am I doing this? And how are the outcomes going to happen? Take the time to really understand what your body is doing. And it really brings a lot of clarity into the ways that you can approach diabetes management. Another question you can ask are, what are the best ways to manage my blood sugars? Blood sugar management is at the core of diabetes management. So ask your doctor if they can either answer these questions for you or refer you to a specialist who can help you dive a little bit deeper into the questions that you have. So if you have questions about eating and your, dietary plan, you can ask to see a dietitian. If you want to learn more about exercise routines, seek out somebody who is working as a personal trainer or somebody who has experience in kind of that exercise space. For medication options or monitoring techniques, you can talk to a certified diabetes care and education specialist, or your doctor also might have some knowledge about how to make that work best and how to help you maintain your blood sugar levels. So asking that question can really unlock a lot of answers for you. Asking to see specialists can be a really helpful exercise because they can dive a little bit deeper with you into things that you want to know more about that you may not get in that 20-minute session. Another question is, how often should I monitor my blood sugars and what ranges should I aim for? A lot of times we're told prick your finger or wear this continuous glucose monitor, and we're not really sure what we're looking for or why we're looking for it. We may not even know that we want our blood sugars to be between 70 and 100 milligrams per deciliter when we're waking up, or that we don't want to go over 180 milligrams per deciliter 2 hours after our meal. Consistently tracking your blood sugars helps you understand your progress and helps you make adjustments when necessary. So ask your doctor about how frequently you should be testing and also what is the target range specific to you. Other things that you can ask are, what symptoms should I be aware of that might indicate an issue or a problem? Being aware of potential warning signs can help you catch complications early. Talk about with your doctor some common symptoms related to high or low blood sugars and signs of other diabetes related issues like neuropathy, retinopathy, your kidney function, your liver function, your cardiovascular health. All of those things have diabetes in common, and all of those things are affected by diabetes. Being aware that these certain things have a tie to diabetes and could indicate that there might be a larger issue at play are super helpful to know ahead so that you can identify them early as they're happening. Usually finding out early that you have a complication means less risk for you overall and means that you can catch it early and you can do something about it a little earlier. Then you can ask if there are any specific medications or treatments you can consider. So discuss with your doctor the treatment available to you. And this could include oral medications, insulin therapy, GLP-1 agonists. It can include lots of different things. Understanding your options helps you empowered to make informed decisions about your own healthcare. At the same time, you should also know why you're taking these certain things and how you should be taking them. So it's not just enough to be prescribed the medication, but knowing what it actually does can help you ensure that you're using it effectively, that you're taking it on time, that you're consistent with your routine, that you're doing all of these things that are good, consistent habits for your overall health. Ask what those medications do. And it's also important to ask what different medications do in case you have allergies or in case you have other medications that you're taking that don't necessarily work with the new medications that are being prescribed. Typically, your doctor will see those interactions, those allergies, and know maybe these two things can't work, or they might see that you have a complication and maybe this certain medicine's side effects exacerbate this other comorbidity or co-condition. It's really important to be upfront and honest about everything that you're taking, but then asking and understanding why you're taking certain types of medications. You can ask if there are any lifestyle changes that you can make to better manage diabetes. This is applicable to all of us with diabetes, whether we live with type 1, type 2, gestational, pre-diabetes. We all can make lifestyle changes that may not necessarily reverse or put into remission our diabetes, because it's not possible for some people. Diabetes affects your whole entire body. And so it's really important to stay healthy in other ways while you're also dealing with this condition. Your doctor can provide valuable insights on diet, exercise, stress management, and other lifestyle modifications that can positively impact your diabetes management. Embrace these changes as opportunities to improve your overall well being, but they'll also improve your diabetes management and other factors that can sometimes contribute to out of whack blood sugars. Your doctor if they can recommend any resources or support groups for you. Connecting with others who share similar experiences can be so beneficial. Whenever you figure out that you're not alone in this, and there are so many other people that are also dealing with this, living with this, who understand exactly how you feel, it really takes a bit of the burden off and it really helps you feel supported and understood. You can inquire with your doctor about local support groups, online communities, and reputable resources that can provide additional education and emotional support. Glucose Guide, my free app for iOS, and it's in the Google Play Store, is that place. It is a place for free coaching, for the ability to feel understood, not judged, to get community support, to get one on one support, to get recipes, to get all kinds of things. Educational and emotional support systems are so important for diabetes management. These aren't all of the questions that you can ask your doctor. There are so many more. I could probably do like 40 episodes on just things that you can ask your doctor. But remember that you are your own best advocate when it comes to managing diabetes, and asking these questions can help you collaborate with your doctor to develop the perfect treatment plan for you. And it helps to empower you to live a fulfilling and healthy life. Knowledge is power, and you deserve to thrive with your diabetes management. Asking your care team some questions like this, especially when you're new to diabetes, can be really helpful for setting you on the right path. All right, this is the end. If you have a question that you like to ask your doctor, definitely chime in on the diabestiepod.com transcript of this episode. You can also get the transcript of this episode at diabestiepod.com, and it will also be up on my YouTube channel. I typically put up the video podcast. People tend to like to watch it that way, which I think is really nice. I am just super excited for this new year. I'm so excited for so many people to be thinking about their health again and to be wanting to just make a way forward and to really embrace diabetes management. Like I said before, if you are somebody who just craves that, you want that, you need that, visit my website, hangrywoman.com/diabetes-coaching, and I am here for you for free. Like everyone's like, there's a cost, there's something behind this. I want people to have all of the resources that they need that gives them a space and gives them a place to thrive. And I want that to happen without costing anything additional. That's it. Not everyone has bad intentions. All right. That's it for this podcast. Thank you so much for listening. And I will talk to you in the next podcast. Take care. Bye.